Hello and welcome to your favorite program on Clearview Television, You and Your Health, a program designed to help you understand your health better and how to combat some certain diseases that are prevalent in the society today. And today on the program, we'll be talking about hypertension and the rising spate of stroke among elderly and even young persons in the society today. And with me in the studio today is Dr. Roland Aigbovo. And of course, I'm your host, Rose Audu.
All right.
You're welcome to the program, sir.
Thank you very much. Nice to be here.
Yes, I'm pleased you honor my invitation. And talking about hypertension, let me start with just this question. What is hypertension?
Okay. Before I go into the specific definition of hypertension, I would like to state that hypertension is one of the non-communicable diseases, and that is actually ravaging the human population at the moment. Attention before now have been too much into communicable diseases, which are the tuberculosis and all those sort. But now it has been established that the non-communicable diseases are also in the increase, the likes of hypertension and diabetes and the others. So, but coming specifically to hypertension now, hypertension actually be defined as elevated blood pressure, more than 140, systolic of 140 millimeters of mercury over the diastolic of 90 millimeters of mercury. That is persistent high blood pressure above that value. Because when you are measuring the blood pressure, it's over the systolic over the diastolic blood pressure. So it's 140 over 90 milligrams of mercury above that value. Though there are some little bit of controversy over that value of 140 over 90 millimeters of mercury. Some school of thought has said that, okay, 130 over 80, while some are saying 140 over 90. But the Joint National Council of Hypertension have actually put it at 140 over 90 millimeters of mercury. That is when blood pressure above that value is referred to as hypertension.
Yeah. Okay, thank you very much.
You're
and
welcome.
Then, having said all of that, who can be hypertensive?
Okay. Well, anybody can be hypertensive, but there is what we call a familiar trait that runs in the family. It could be genetic. There are some environmental factors that can cause hypertension. Even our lifestyle can also cause hypertension. So basically, it's genetic. It could be that is also familiar, runs in the family. There could be environmental causes. There are also hormonal causes of hypertension. So all these have interplay of how causing hypertension.
Can you dwell a little on the environmental factor that can lead to hypertension?
Okay. Now, when we mention environmental factors, there are like of recent when you have this issue of lead poisoning, pollution, then the issue of people having to do much more than they ought to. For instance, of recent, you know that there was this, I won't call it earthquake in Abuja anyway, but I think there was some activities that shook the ground and everybody was saying was a result of the quarry activities in Pape and all those sort of things. So now when these quarry activities is being done, and it release a lot of gases into the air, and people have to inhale that, and once they inhale, it causes a lot of changes in their body system, which actually also prone them into having high blood pressure. So those are the environmental effects factors that can actually lead to hypertension. Because what it does, it may not cause it directly, but it causes the changes in the body, which on the long run will lead to the patient having hypertension. So whether directly or indirectly is a known cause of hypertension.
Wow.
Yeah.
And then talking about these environmental factors, outside these obvious factors,
Yeah.
Are there other causes of hypertension, things that actually can lead to hypertension?
Yes, there are. Like I said, first another thing is your lifestyle. When somebody lives a sedentary lifestyle, sedentary in the sense that you spend more time sitting rather than moving and at doing any form of activity. And studies have shown that when you sit for too long or you are not really active, whatever you eat, you are bound to gain weight, And in gaining weight, once you gain weight, there's high chances of you to develop what's called increased cholesterol, lipids in the body. And once they develop that hyperlipidemia, like we call it, it lines the tube, the vessels of the body. So once those vessels are aligned, it reduces the lumen or the diameter of the vessels. So leading to the fact that when the heart now pumps blood, you now need to go through a little bit of pressure. Unlike where you have a normal pipe that water flows through. When that diameter is now reduced, now leads a whole lot of pressure to pass through that pipe. So that's how sedentary lifestyle causes hypertension. So the heart will now have to go into pump much at a higher pressure. They're able to supply blood to those other parts that have a narrowed lumen. Yeah.
Okay, so is hypertension curable?
Well, I won't say hypertension is curable, but it can be managed. Because when a patient has been diagnosed hypertensive, you have a whole lot of work to do on how to manage it, whether use of drugs or non-drug use of management of hypertension. Well, we call it non-pharmacological and pharmacological. Pharmacological means use of drug, while non-pharmacological is other things you do like diet, exercise. Then the other issue you have to do is increase physical activity to reduce the cholesterol level or the lipid profile of the body. Pharmacological is the use of drugs to actually bring the blood pressure down. Now, why I said it's not curable but can be managed is that once you are placed on drugs, you need to be on those drugs. Because anytime you go off those drugs, the chances that the blood pressure will increase. It's just like putting your palm or your hand on the spring. The moment you put your hand there, that spring is the way it is. But once you take your hand off the spring, the probably for it to have a rebound. So on that ground, hypertension is not curable, but can be managed.
All right, thank you very much.
You're
and
welcome.
then moving on, over time we've seen a lot of, elderly people suffer from, stroke and, so many bearable diseases and all of that. And that will lead me to my next question of what actually causes stroke? What leads to stroke?
Okay. Stroke, like, it's called the term we call it cerebrovascular accident. Cerebrovascular accident in the sense that, cerebrum, which is the brain, vascular, which is blood supply. So when there is either a reduced blood supply to a particular area of the brain, or there's an excessive blood supply to a particular area of the brain, leading to other events. Now, stroke is a situation. There are actually two types. We have what we call the ischemic stroke, or we have what we call the hemorrhagic stroke. The ischemic stroke is when there is reduced or reduced blood supply to a particular section of the brain, thereby leading to the death of those cells there. Once those cells around that particular area is dead, this nerve, the function, the part of the body which that part of the brain controls, there is loss of function. Now, the hemorrhagic stroke is when there is excess blood supply to that particular part of the brain, leading to those vessels tearing up, or what we call, when there's, I'm trying to use a layman's word now, or as it tears up, or we call it rupture.
Okay.
You understand? When it ruptures, then excessive blood supply. Now, once it ruptures, those parts of the brain will not actually get the blood supply that is needed. So those are the two types of stroke, the ischemic and the hemorrhagic. Now, once this happens, those parts of the brain, the part of the body where those brain supplies, they have loss of function. That's why you see people just wake up one day and or whatever the stroke happens, they find out that they say they cannot raise their hand or their leg. It's like one part of their body is paralyzed. That's to tell you that the part of the brain that controls that part of the body has been affected. So that's how stroke happens.
Wow.
Yeah.
This is interesting. In case you're just joining us, this is You and Your Health on Clearview Television. And my name is Rose Aldo. I have with me in the studio Dr. Roland Aigbovo. And we'll be going on a very short break. When we return, the program continues. Stay with us. welcome back. And before we went on that break, we were discussing hypertension and the rising speeds of stroke among elderly persons. My name is Rose Audu, and I have with me in the studio still Dr. Roland Aigbovo, who has been talking to us about, hypertension and what actually causes this disease. And before we went on that break, we talked about stroke. And that will bring me to my next question. How can one survive stroke?
Okay. People can actually survive stroke. There are sometimes there are some what we call events that leads to the stroke. Some they have what we call transient ischemic attack. Situation whereby somebody will just wake up, he cannot lift the hand or the leg as if one part. After like within 24 hours, he regains his function. That's what we call transient ischemic stroke. And once somebody has had that, it sure means that that person will definitely come down with stroke. Now, stroke can be managed, but it also now depends on how it is managed. A large number of people in our country still believe so much in traditional medicines, whereby once things like this comes up, they want to go into those traditional facilities to manage and everything. But once the stroke medically, once the patient comes in with stroke, first and foremost, you need to manage the blood pressure, which is the offending pressure. While managing the blood pressure, you need to find out what kind of stroke. Is it ischemic stroke or hemorrhagic stroke? But both of them has similar management, but a little bit of difference. Now, if for some, they need to do a CT scan, do all those radiology investigation to know the actual part, whether it is hemorrhagic or ischemic. Then you now take it up from there. But most importantly, you need to bring down the blood pressure to a considerable level. In bringing down the blood pressure, the goal is not to crash the blood pressure. Crash in the sense that you see a blood pressure of 200, 120 milliliters of mercury. You want to, within 5-10 minutes, bring it down to 120, 80. That is not the goal. Because over time, before the stroke occurred, the person has actually been managing with that particular blood pressure. So in bringing it down, you need to bring it down in a stepwise manner, not crashing it. Because if you also bring it down too frequent, you're going to cause more trouble to the patient. So once the blood pressure is controlled over time to an appreciable level, now the patient will now have to undergo what we call physiotherapy for how to please start regaining function. Mind you, I've actually explained that is something that affects the brain and function. So once the blood pressure has been controlled, now you now have to also pass to that part of the body to regain function of the use of that part of the body. So that is the goal. But most times when they present at traditional healers, they all pay more attention into the function, leaving out the blood pressure. If you are trying to regain function and you not manage the blood pressure, of course you can know that it will occur to you that, oh, it's like you are working at variance with yourself. If the offending situation or issue is not taken care of, now you are trying to do the other part. Of course, you won't achieve what you want. And that is why you see many people, maybe with time, the blood pressure might go down on its own, or they might tend to regain function. But medically, you need to bring down the blood pressure.
Okay, now talking about, maybe with time, the blood pressure might go down on its own.
Yeah.
Is there any situation or is there a possibility of someone who is hypertensive, getting cured without, any medications or anything?
No.
There is no possibility.
There is no possibility. So long as, and mind you, before you make a diagnosis of hypertension, if somebody comes into like a consulting room or come to the hospital and have a blood pressure of maybe 160, 100 at the first time, it doesn't necessarily mean that person is hypertensive. You understand? But if that person's blood pressure is persistently high, or after 2 or 3 occasions that he took the blood pressure and it's above that 140/90, that's when you can make a diagnosis of hypertension. Because there are some types of hypertension, like the pregnancy-induced hypertension, which most is caused by pregnancy. At the time that pregnancy is done, the blood pressure goes back. Though I didn't mention the issue of the different types of hypertension, or the essential hypertension, the pregnancy-induced hypertension, and all. So once the pregnancy is reduced, it's removed, the patient has delivered, you find out that the blood pressure goes down. Once the offending item is removed. Now, if on the other part, you need now to manage this patient to the extent that sometimes there are where patients will have to be, rather than taking drugs daily, they need to alternate the drugs when it is well controlled. a patient, of course, we see a lot of patients every day that they tell us that, oh, doctor, if I take this drug, my blood pressure goes this low. And if you keep taking that drug and it goes lower than that, it will not be to his own, to be to his own detriment. So most times we tell them, rather than stay off the medication, you need to now take it, skip a day in managing the blood pressure. That without drugs, the blood pressure goes down. I doubt that.
Okay. Yeah. All right. How can a particular lifestyle, contribute to hypertension?
Wow. Lifestyle modification plays a very big role. Now, your issue of smoking, smoking cigarette contains nicotine. And nicotine has its own effect. It has a way of making the blood remain fluid in the body. And once you do that, the blood circulation will also increase. Smoking, then alcohol. What alcohol does is to, first and foremost, patients have to start gaining weight. And in gaining weight, most times come down with obesity. And obesity is directly linked to hypertension because of overweight. And now somebody that is physically active, one, the chances of developing obesity is low. Taking the issue of alcohol, once you reduce your alcohol intake, of course, it definitely have effect on, it has to prevent you from having hypertension on the long run. Mind you, these factors I'm mentioning, apart from the overweight, obesity, alcohol and cigarette, not actually a direct cause, but is implicated in hypertension. And once you do your normal exercise, you're physically active, all these factors will come down and you live your normal life.
Okay. Is there a particular diet for hypertensive patients?
Well, for hypertensive patients, there is really no diet restriction for hypertensive patients. But what we tell them is that, a lot of people have this habit of after their meal is served on the table, they'll say, oh, there's no salt and all those, so they want to add salt on the table. While you are cooking and you add salt while you are still cooking, the heat will actually break down that salt. But once the food is served and you don't add salt while this food is already served, you know that, of course, though the food will be have the taste, but the salt content will actually have increased. And salt contains sodium chloride. What sodium chloride does in the body is what we call is an expander, plasma expander. You have to increase the blood volume. And if you continue to consume salt, table salt at that level, it definitely will increase the blood pressure. And even if you're already hypertensive, we also tell them reduce your salt intake so that you're able to control your blood pressure to an appreciable level.
Okay, now, let me just ask, like a layman. Of course, I'm not a medical practitioner, and I know a lot of Nigerians, people are watching out there. And is there a particular or a permanent cure for hypertension?
There is no cure for hypertension. I have to be blunt about that.
There's no permanent cure for hypertension.
There's no permanent cure for hypertension, but it can be managed. And the fact that your hypertension has been managed to a level where you have to skip drug, or sometimes you stay off drug for like a week or two, or for some a month, doesn't necessarily mean it has been cured. It's just that the blood pressure has been maintained for whatever reasons. But any attempt for you to either go back to where you were doing before, or the things that were actually triggered off that hypertension, of course, the patient will go back to the normal state. It will go back to the hypertensive state. That is cured permanently, like malaria, where you take drugs, it's always cured. No, there's not.
Okay, there's no permanent cure for hypertension, and we have to be careful with what we eat, especially the salt intake.
Yeah, salt intake.
Now, I would also want to know if certain medications can trigger hypertension.
Yeah, not really directly, but there are some drugs, like for instance, some drugs we use to manage diabetes, that can actually prone patients into gaining weight. And once they gain weight, they are most likely going to have hypertension. So for hypertension directly, no drug is directly linked to that for now, except, with exception of, for instance, we have what we call the chemotherapy drugs and agents who actually have effects on the body. If those drugs target those organs, like for instance, any drug that will affect the kidneys. The kidney plays a very important role in the body. and also in hypertension. If any drug that will cause the damage to the kidney will actually make patient have hypertension, and sometimes even liver, because most of the drugs that are used in treating these conditions are either are metabolized in the liver and excreted through the kidney, the urine and the kidney. So drugs that affect these organs will definitely cause hypertension.
Okay, now, some people, especially, most Nigerians or so many people, we are guilty of going for self-medications. Maybe you start feeling down in your system and all of that, and you just decide to go to the clinic, get drugs and all of that. In a situation where a patient uses a particular drug and it triggers this hypertension, how do you manage that situation, and how do you advise these patients to stay off using certain drugs?
Okay, for the issue of self-medication, Nigeria is still evolving. There are actually some drugs that are called prescription-only drugs, which means you can only purchase that drug with a drug prescription from the doctor. But fortunately, in Nigeria, where there are really no strong implementation of these rules, things just happen. Now, when a patient takes particular drug and they notice that it's not having high blood pressure, mind you, many of them might not know they have high blood pressure. Maybe they start complaining of headache or dizziness, or some of them can even go into coma, depending on the state of which they can notice. So hypertension is not just something patient will just feel, oh, I have high blood pressure. Many of them come down with headache, some of them dizziness, some of them might just go into coma, or some of them the first thing they will notice is that can't move the arm, can't move the leg. Now, if they take any particular drug and it's noticed that it was when that drug was taken that this issue started, the first thing you should do is to stop that drug. You stop the drug. Now, know the class of drug. Try to find out the effect on the body, how it led to that particular situation. Then you now have to give drugs to actually bring the blood pressure down on that particular item.
Okay, before we go, I would also want to know, how deadly is hypertension?
Very deadly.
Okay.
If I say very deadly, it's not as deadly as Ebola or Lassa fever and all those stuff. But one thing is that once the patient has been diagnosed hypertensive, the patient needs to take extra caution about his or her life, because the end point of hypertension, before the end point, stroke, then death. And once a patient is had stroke, most times they don't get 100% recovery. There always be that little difference that, this person have had this issue and all those stuff. So generally, the world medical practice now, we are moving from curative medicine to preventive medicine. And I believe this is also another forum to actually talk to our people about their lifestyle, on how to on how to go for routine medical checks, and also to make sure, especially those who, one way or the other, hypertension runs in their family. So they need to actually be more cautious of their lifestyle. Yeah.
All right. Now, I want you to maybe look at the people, because, of course, so many people are watching you out there, and then talk to them as a medical practitioner. And, I don't know, just talk to them on how to stay off hypertension and how how it can be managed. Or maybe some certain symptoms, like, of course, it must have symptoms and all of that. So you can just...
Okay. I think what I will just do, I'll just give an overview of summary of what we have been talking about the last couple of minutes. Hypertension generally is, like I said earlier, is persistent blood pressure of 140 systolic and 90 diastolic millimeters of mercury. And many people may not know that they have hypertension. Maybe they start feeling headache, or some people feel dizziness, some will feel blurring of vision. So, I can't see very well. Or some will come down with, I can't move my hand, I can't move my leg, and all that. And they come, make a diagnosis, check their blood pressure. Sometimes it's most times it's high. I would say, this person is hypertensive. Now, after a series of questions and what we call examination, we now have to find out which particular one is it essential hypertension, or is caused as a secondary to a particular disease. And once that is established, and we also know that drugs mainly is used to treat hypertension. But before that, investigations are done to find out how the renal function and the liver function, because the drugs are going to be administered to to patients is metabolized in the liver and excreted to the urine. So if you have problems with these organs, you need to first and foremost sort out those problems first. If not, the drugs are given to the patient further aggravate the situation the patient is. So once that is done, the hypertension is clearly managed. Stay on your drugs, avoid things like I said, table salt, do a lot of exercise, increase your physical activity. Not well, studies have shown now that when you sit for like 1 hour, you should walk, stand up and walk for like 30 minutes at least, just exercise yourself, rather than some people will just sit down from morning to night. Like I always say that some people would leave their room, bedroom AC to sitting room AC to the car AC to office AC. All these are not really good without having to do exercise. Exercise doesn't necessarily mean you running or jogging. Brisk walking, walk around your compound, you have a big compound, or walk on your street, something to make you just at least do some little bit of exercise. And it's recommended that 150 minutes in a week is fair for physical activity, which is an average of 20 minutes per day for physical activity. All these will improve quality of life.
All right, thank you very much.
You're welcome.
And there you have it from Dr. Roland Aigbovo. And do something. Don't sit in one place. Exercise, eat right, and, avoid certain lifestyles. That's what you get when you watch You and Your Health on Clearview Television, and where you get to know more about yourselves and how to avoid, certain sicknesses. Until we come your way again, same time next week, I remain your Rose Audu and your host on the program. And please remember that you can always subscribe to our YouTube channel via Clearview TV and like us on Facebook via Clearview Television. You can also follow us on Twitter at Clearview Online, and also follow us on Instagram at ClearviewTV_NG. You can also watch Clearview TV on Nigecomsat with any free-to-air decoder. For details on that, you can actually contact your local installer. Till we come your way again, remain blessed and keep watching Clearview Television.